Butler. Today we're going to talk about head injuries and traumas in children. And joining me is Dr. J.W. Hendricks. He's the Medical Director of Medical Services for Blue Cross and Blue Shield of Oklahoma. Welcome to the program, Doctor.
Oh, glad to be here.
Now, before we start specifically about the different kind of head injuries and traumas, tell us, how big of a problem is this? Is this something that kids are experiencing, more children, or is it been about the same no matter what generation we're in? Or tell us kind of how that's looking.
Well, it's about the same, but then when you get out in ranges, certainly with athletics, the children are getting bigger, stronger, and so force becomes an issue. And the other part of it is, I think we're becoming more aware that concussions are not something to be ignored, that these are cumulative, and so we need to pay attention to each one. So it's a greater awareness and possibly a slight increase in severity.
Okay, well, let's start with concussion, since you mentioned that.
Okay.
Exactly what is a concussion?
Well, a concussion is, I guess, in a way to look at that is someone is just addled. There's not any bruising or bleeding or any ongoing damage that one could see if you did a CT scan or an MRI. But there's definitely something that has affected the function of the brain. So people are not thinking well. They may not remember the event. They may have been knocked out. You can have a concussion without being knocked out. But we see this as a change in function following a head injury, but there's not any physical damage that one can determine at this point in time, and so that can last anywhere from a few seconds to a few minutes, and the longer that it lasts, the more significant the injury is. But technically speaking, there's not any bruising or bleeding that goes along with that.
Okay, and so when you mention that, like you say, concussions can go undetected, especially by laypersons or parents or things like that, if they don't see any physical signs maybe. So what things should we look for, those subtle or obvious signs, other than, because we do look for bruising? Did you get a bump on your head? You know, do you have some bruising? What should we really look for?
Well, the big things is to look to see if there's been a change in their behavior. I mean, obviously, if someone's been knocked out and they can't wake them up, then people do pick up on that. But you know, there are always the stories of the football player that gets a big hit and he's just kind of standing in the middle of the field. He's not knocked out, but doesn't really know where he is. And somebody calls him and says, "Do you know what's going on?" And he goes, "I'm at home." So sometimes it takes some questioning and asking, you know, what's your name? Do you know where you are? Do you know what you're supposed to be doing to see if someone is in there? So if it's apparently mild or hidden, generally some questions are going to let you know that, gee, that we're not working well at this point. That brain is not working, and so we need to do more.
Now, let me ask this. Can you have the concussion then, and initially the child appear to be okay? I mean, they jump right up, they're responsive and everything, and then all of a sudden, maybe later there's some changes? I mean, how long should we maybe look for changes or kind of check their behavior or see how they're reacting to things or asking questions? Or is it right at that instant, if everything is okay, they know where they are, they know who they are, all is well?
Well, you know, that's a really good question, and I would separate that out into two things. Number one, there usually is a change right then, but people don't ask the questions or they don't recognize it. And there have been stories that people often hear that, you know, I didn't remember anything after that until I got home, and suddenly I realized I was home and didn't know how I'd get there. So there's a change, but it's not apparent. No one really did that fine questioning to see, do they know where they are, do they know what's going on? The other part of that is they seem to be okay, but then they're getting worse. That is a more severe situation. That usually suggests that there's bleeding or swelling of the brain. It may be related to the injury, but now this is getting worse. And that's one of those things that I always tell people to watch for. If they've got a headache that's getting worse, or the symptoms are getting worse, and you know, I don't remember the situation was in Colorado, but everybody heard about that someone had a skiing injury and they'd had the ambulance come 2 different times but sent away, and then suddenly, I mean, this is something that's progressing, and so anytime something is getting worse, definitely that's a major warning sign.
Now, with head injuries like concussions, would you tend to have nausea or vomiting or things like that? Because we're talking about now like being disoriented or severe headaches or things like that. Can it lead to nausea, vomiting, things like that? And if so, would that be a real emergency situation or what?
Well, that is one of those symptoms. And so, you know, I would start that anytime when someone's concerned about an injury, that should not be dismissed. But things that have me concerned when I get a history of that is a child that's fallen from over 5 feet, a child that's vomited more than once, a child that has a headache that's really bad, or it's getting worse. Someone that is not walking normally, seems to be off balance, they're dizzy. That's definitely going to be a concern that is going to have. If they're confused, you know, again, not knowing where they are, that's definitely, and these are kind of increasing severity that would be there. But they don't remember the event, and something, you know, do you know what happened? And they go, no, I really don't do that. That amnesia for the event is more severe, and that may be something that is going to be found out later. Other things, what was the injury? Sometimes people say, well, they fell. Well, what did they fall from? Well, they fell from a horse, or, you know, that additional information. If they can't tell you, then that's going to be a concern. So just asking a few questions or getting that information, those are the things when people say, my child seems okay, but he fell out the window. I want to take a look at that and see what's going on.
Well, that also because we've heard of sometimes when kids are taking naps, especially after they maybe fallen, small kids, and they fall a lot sometimes with their balance till they get that straight. And they're not easily, you can't wake them up very easy, or you know, you have to kind of shake them when before you could just call their name and they would pop up. Those are things too that we should contact the doctor for, right?
Well, I think so, and then you have to kind of put that in context. If we went in at 2 in the morning and tried to wake up our child normally, they wouldn't wake up immediately either. So if usually when certainly a smaller child has fallen, there's a lot of crying, they're more likely to fall when they're getting close to nap time anyway, or when they're tired. So if they do seem sleepy or fall asleep, that's concerning, but not necessarily a major worry. And so in 5, 10, 15 minutes, it's important to wake them up so that you know that they can be awakened, and they're going to be aware. They may still be a little bit tired if it's late at night, but they're going to be aware. Now, we move into a school-age child, an adolescent that's doing that. That's much more concerning if they're really sleepy. So each age range is kind of changing, but it's something, anytime that happens, they need to be watched very closely.
Okay, now let me ask this other question too before we go to break. Once you've had a concussion with a fall, if you tend to have future falls, I'm thinking about athletes or future injuries to the head, especially with sports, are you more prone to more serious consequences because of that, or is it about the same?
That's kind of a two-part answer as well. And head injuries, the brain is an extremely complex organ. We ask it to do a lot, and so that's sort of a tough deal. So looking at that first part, if we've had a concussion and it was mild and they're back to normal in 5 or 10 minutes, then that's okay. If it's taken them a day before their headache is gone, then they need to be watched very carefully to be sure, because we do know, and these are obviously significant injuries in football players and boxers, that concussions are cumulative. So each one can tend to be more severe if you're not totally back to normal.
Okay, excellent. Thank you so much. We're going to take a really quick break
and
come back and look at some head traumas and neck traumas.
All right, great. Okay. Thank you.
Please stay with us. We'll be right back.
Learning how to kickflip 6 stairs takes determination. So will getting into college. I've got what it takes. So do you.
Welcome back to continue our discussion talking about head traumas or injuries in children. Joining me again is Dr. J.W. Hendricks, Medical Director of Medical Services at the Blue Cross Blue Shield of Oklahoma. Let's jump in.
Hi.
Hello again. Now, you did a great job talking about concussions and what we should look for and how we should even gauge them based on age, time of night, in terms of trying to get some idea of how easily the child is to be aroused, all those different kinds of things. I want to ask you to move into a school setting for me, because that can be a little bit different. When we look at head traumas or neck injuries, tell us a little bit about the kinds that we may see there and will roll into symptoms and all those kinds of things. What kind of traumas do you typically tend to see associated with schools?
Well, usually, I mean, it could be a fall down the steps or they slipped on the floor, but usually it's at an athletic event or at gym. And it may be observed, it may not be. But I think that in any type of fall, first thing to do is to look and say, are you all right? And that's going to tell you whether they're aware of things. But do you hurt anywhere? Before people start moving or picking up or anything like that, it's a good idea to ask where they hurt. And that may be that they've got a broken limb or that they've got a bad bump on their head. Even to the point of concussion, or maybe even a neck injury. And so if one thinks that may be a possibility, that my neck hurts or something, then it's a good idea to immobilize whatever they're complaining about until you're more sure about what's going on. So making that quick assessment, what happened, are you okay, do you hurt anywhere? And obviously you're going to be looking for some bleeding at that point because they could have a laceration or a cut that could be significant. Mm-hmm. So that's a quick assessment to see where things are and what you need to do. So if there's a concern about a neck injury or neck strain, then immobilizing is a good thing to do. Not everybody has a collar that's right there, but you can take a rolled up towel and wrap it around the neck so that they're not going to be moving around. And if there's any question, then it's a good idea not to move the child at all and call IMSA so that you've got emergency medical services to come, and they definitely have got the equipment so that they can move someone if need be. Now, if they're moving around saying that I'm okay and getting up, then that's okay, and then you can kind of go further from there. But that quick assessment before one does anything can make a really big difference. Okay.
Now with this too, especially with playground injuries and things like that, the pupils, sometimes we always think about, well, and you hear that a lot, or are your pupils dilated, are they constricted? Do the pupils play any role in us trying to figure out how the child is doing, or with head and neck injuries, or not really?
Well, difference in the pupil is probably the biggest thing to look at. Okay. And so we'll often ask, are the pupils the same size? Because depending on how much light is around, or if you put a flashlight in there, they're going to constrict or they'll get, but you shouldn't have one that's big and one that's small. I would be willing to say that 99 times out of 100, that's not the only thing that you're going to see. There are going to be other issues, but a lot of times people will ask, we've had a fall, and we'll just ask if the pupils are going to be the same size. That gets to be even more important in a younger child who may just be crying and they can't tell you about where they hurt or what's going on. But certainly in a school-age child, especially middle school, high school, there are going to be other things to look at. But again, to be sure that they're equal. Okay. Would be what I'd look at.
Now, when you have some of the head and neck injuries too, and I'm thinking about, the ability to move your limbs and things like that, is there any kind of sort of check we do there in terms of seeing whether they can move their arms up and down? Can they squeeze anything? Does that fall into anything that we should sort of try to look at?
It does. It's helpful, but now you're getting into a little bit more subtlety. So I'm usually at that point of just saying, where do you hurt? Can you get up and move? And a lot of people watch football, watch basketball. They look to see what happens when a player is hurt, and you see people come over and they're not getting anyone up. They're talking to them, letting them get themselves up. They may help them, but they're looking to see where they're hurting at that point. So I think that's a really good model to say, this, when I'm watching these sporting events, that's what I want to do if somebody gets hurt.
Okay. And even in schools where you may have healthcare providers, do you recommend that they do a little more specific assessment, or just in general the same kind of thing?
Well, that's always the best thing to do. And if one wants to look more to see if the grip is the same, or if they're moving their extremities equally and stuff, then that's fine. But that initial assessment before they're up and about makes a big difference. And if they tell you, gee, my arm is really hurting, then you look at that and go, yeah, that's a little crooked, so we got a problem here.
Okay. Now, when kids then go back into the classroom setting, let's say they're appearing to be okay, and of course you contact the parent, let them know what happened, but they're appearing to be okay. What kind of information would you say teachers and others where that child is going to circulate throughout the day, what should they know specifically? Because sometimes you've got a lot of kids in the classroom. You know, you're really focusing on the ABCs and all that and the 1, 2, 3s and all those things. What kinds of information should that teacher have about that child?
Well, I think knowing that it happened and what happened is helpful. So that little extra communication does make a big difference, and that may need to go from teacher to teacher. And watching to see where things are over the next 30 minutes to an hour is probably going to be the real telling thing, but that ongoing watching, I think that if it happens in the morning, that pupil should be observed and aware that there's an issue along, because it's possible that they may be nauseated and vomit later on. And so that could be taken out of context. So I think communicating down that train for the whole day would be a very helpful thing.
Okay. Now, should the parent really, even though the child is appearing to be okay, because sometimes that becomes a concern across the board, should we recommend always that they still go to their physician to be checked, or just watch for the things that you mentioned in our first segment in terms of the subtleties that can occur, or should they just take them anyway if they have access to a healthcare provider just for a general check to make sure everything is kind of okay?
Well, obviously that's the parent's ultimate responsibility, and I think that, and as well as something that they need to be aware of, in the sense if they know what the injury is and how things are going, then I think that any teacher or school nurse or anyone involved can feel comfortable when they've given that information to let them make that ultimate judgment about whether they need to be checked or not. And when in doubt, I never think that that's a problem. It becomes awfully difficult sometimes to say this is what I saw and what you need to do. And obviously from a physician's standpoint, we would much rather give good news and say everything looks fine than be 5 minutes late in dealing with that. And so that's not to make people worry, but good news is always good news.
Okay. Now, how should we deal with medications? Because sometimes, of course, parents want to know, or should you give children's Tylenol, ibuprofen, aspirin? Yeah. What should you do if the child is having kind of like a little mild headache? Or sometimes people will say, well, I just want to prevent them from having one. So I want to give them something. What's your take on that?
Well, obviously, I mean, you smile when you mention aspirin,
That's right.
and obviously we don't do that. But the Tylenol or acetaminophen or the ibuprofen, certainly that is okay. But I think the important thing to know is that you have now lost something to monitor easily. Is this pain getting worse? Because everything changes when you've given something for pain. So if they're uncomfortable, it's okay to do that, but now you can't judge that things are getting worse based on the pain. Okay. So that may, if one is having to do something for the pain, that this is not going away in 5 or 10 minutes. And I would say that 10-minute rule is a good thing. If there's bleeding and I can't stop the bleeding in 10 minutes, that needs to be checked. If there's a headache that's not going away in 10 minutes or seems to be getting worse, or just in my mind, if I'm having to give something for this, I'm going to watch this more closely. And so if it doesn't completely go away, then definitely that would be a warning sign that it should be looked at.
Okay, we'll take a break and come back and talk about some more head injuries.
Okay.
Please stay with us. We'll be right back.
RBIs and 36 homers. Swings at the first pitch and fouls it deep back into the stands.
Chill raw and prepared foods promptly. 1 in 6 Americans will get sick from food poisoning this year. Check your steps at foodsafety.gov.
Welcome back. To complete our discussion, talking about head injuries and head trauma, joining me again is Dr. J.W. Hendricks, Medical Director of Medical Services at Blue Cross and Blue Shield of Oklahoma. Let's jump in for our last segment. Okay. Now, before I sort of transition to looking at mouth injuries and that, I do want to ask one more thing about the concussions that we talked about in the first segment. Is there a rule of thumb or kind of how people look at when you can return to sporting activity for sports, especially for athletes?
Well, there are, and it's somewhat specific to school systems or states as to what guidelines that they're going to have. That obviously, if a child has had 2 concussions in a week, they'll have formal guidelines on how long a child needs to be out before they can come back to play, or what type of evaluation they need. But I think from a parent standpoint, is my child back to normal? And they should never return to an athletic event until you're sure they're normal. So if somebody gets knocked out at a game, they're done for the day. If that happens at practice, they're done for the day, because they need to be observed at that point. And I think that the helpful thing is, okay, we did have a concussion, but the next day they seem to be fine. I would not let them go back to a full practice or another game. What I would recommend doing is to see how they do at school, and should not have any risk of a contact sport. So if they make it through school and they don't have headache, nausea, and they're not sleeping or feeling tired, then maybe the next day they can go to gym at school, or maybe they can go to practice but no contact. So it's a very careful and logical progression to see that they're back to normal.
Okay, excellent. Let's look at mouth injuries. Tell us a little bit about mouth injuries.
Well, they're almost always associated with blood, and certainly for a young child, when they see blood coming out of them, that's a worrisome thing. And as one of my professors in pediatrics once said, that kids are kind of like cars. As long as what's dropping from them is clear, you're pretty good. But if it's brown, green, or red, that's not a very good thing. And so,
that's a good point.
it's a simplistic way, but you know that there's a bit of a worry. But with mouth injuries, it could just be a bit of a bruise. Obviously, in a young child, the primary teeth don't have real strong roots, and so they're a little bit easier to get knocked loose. So a baby or a toddler, they're more likely to get crooked or be a little loose. And so if we do have injuries to the teeth, the best thing to do is to leave it alone, not try to straighten it up or anything. It'll usually take care of itself. If in doubt, and you have a family dentist or a pediatric dentist, it never hurts to call them. If a tooth gets knocked out, and again, that's a difference whether it's a permanent tooth or a primary tooth, it's a good idea to save it. If it's dirty, you can just rinse it off with some water. An older child, if need be, you can just have them put it under their tongue until they can get to the dentist to get that checked. If you don't have that or don't want to do that, then some milk is a great thing to put a tooth in until that can get checked. But you don't want to get too aggressive with it or mess it. And usually you've got 15, 30 minutes or an hour that you can kind of work around with it depending on when it happened and stuff. So always save parts and take them in to get that looked at. I think that obviously when one has an injury, you can cuts on the lip or that are going to the outside of the mouth, that's probably going to need to have some stitches. But if it's on the inside of the mouth, probably isn't. And again, I'd use that 10-minute rule. If I can get the bleeding stopped in 10 minutes, we're in probably pretty good shape, and it's not going to be a major issue for them. But I've seen mouth injuries that look pretty bad, sometimes bad enough that I've even referred a patient to an oral surgeon, and they'll usually look and it's going to heal up just fine. Cuts on the tongue, bites on the tongue, usually don't need to have stitches unless they're right at the edge and so that they're gaping apart.
Okay.
So that's, again, but when in doubt, it never hurts to get things checked. If one is in an athletic endeavor where you're more likely to have a mouth injury, football, boxing, any sport, really think about the benefits of a mouth guard. It protects everything, including the teeth, and the cost of a mouth guard is much less expensive than one visit to the dentist or the doctor. And so buy them, use them. I've had some athletes say, I just don't like to play with it, and go, well, you don't have to wear it, and you don't have to play either. Sort of like bicycle helmets.
Exactly.
You don't have to wear a helmet, but you don't have to ride a bicycle either.
Well, and I know too with mouth guards, because some time ago I did a show about mouth guards, but people need to also care for them properly because they can have a whole lot of bacteria on them. And there used to be this, I think they kind of stopped that, this universal thing where they put mouth guards just in a big bucket or some kind of thing, and people just pick them out and that kind of thing. So people really do need to watch that factor too. I mean, it's not a mouth injury per se, but the bacterial content of it and cleaning it and proper storage.
Oh, right. Cleaning before you store it and cleaning before you're going to use it. And I would say that it goes for pads and anything. That's a single-use type of thing. That person uses it and they need to be responsible for cleaning it.
Right. Now, with mouth injuries, is it good to always try to rinse them out? Because sometimes we may try to stop the bleeding in different places, but should we try to rinse them out or have the person gargle? Or, I mean, sometimes that's our initial thing if it doesn't look too severe, but should you not really even do that?
Well, it's always a good idea to look to see how bad that is, and sometimes that may need to be rinsed off, but usually with a mouth injury, unless it's an older child, they're pretty loath to having anybody look around in there. So
to even touch, right?
And if it's a young child, a popsicle is a great thing to have them suck on, kind of cool things down. Ice does a good job to decrease bleeding as well, and preferably don't use a red popsicle, but it can help a little bit, and then you can get a little look in 5 to 10 minutes. And a lot depends on, if it's oozing a little bit, that's fine. You can take 1 drop of blood in a sink of water and it's all red. But and the same thing is going to happen with the mouth, but if it's obviously bleeding and it's fresh blood, then and it's not going to go away with pressure, then that's the best thing to get that looked at.
Okay, I do want to ask here in our last minute or so about the nose. Throw this one on nose injuries. I mean, how should we treat those? Should we try to splint them? Is it looking at how well the person's breathing to get them to the doctor? I mean, how do we look at an injury to the nose?
If it's just bruised or swollen, then usually a little ice on there is all that you're going to need to do. If it's bleeding, again, I'd use the pressure thing. It's don't lay back, don't put your head back. Just sit up in a comfortable position and pinch the nose together for about 10 minutes. Sometimes people want to stop at 5 minutes, so I'd say 5 minutes minimum. But that 10-minute rule is a pretty good thing to pinch it, and most of the time that's going to stop it. Trying to remove the clot, if it stopped bleeding, is only going to start the bleeding again, much like if we've got an abrasion on our arm or finger or something, washing that off again is going to get it to bleed again. So most of the time just leaving will be fine. If there's breathing problems, obviously that's going to be a bit of a concern because there may be more swelling in the nose, or if it's off to a side or something. Okay,
so make sure you just watch that and sort of treat it as the general nosebleed until you can see evidence of something a little more concerning.
Right, and when they're just sitting up, they're going to have, and it's pressed together, they're going to have less bleeding that's going down the back of the throat, less likelihood of swallowing blood, and which tends to make people sick at their stomach, and then they throw up, and it's more of a worry.
Okay, thank you so much for your clarity and help with us with head injuries and traumas. Thank you, Doctor.
It's my pleasure. Thank you so much for having me.
Well, that's our show. For Health Alert, I'm Pam Butler. I'd love to hear your questions, comments, or suggestions for future shows. Please write me at Health Alert USA, P.O. Box 50913, Tulsa, Oklahoma 74150. Or if you're on the email trail, please email me at healthalertusa@gmail.com. And also visit me on YouTube at youtube.com/Health Alert USA. And remember, look at your child, ask the questions, see if they know who they are, where they are, what time it is, whether it's on the field, if it's an injury, or once they get home, and be diligent. Take care.